Hey, what's up everybody? Mark Green here from diabetesdietguide.com, and today we're talking about type 2 diabetes remission. This is a video I've wanted to do for some time. I've actually had the written articles up on my blog, but I thought it'd be nice to do a video complement for people that prefer to watch. The research that appears to have kicked off all the buzz was a study that was published at the back end of 2017 called the Direct Trial. They studied 298 people who were newly diagnosed with type 2 diabetes. And by newly diagnosed, we mean diagnosed within the last 6 years. So none of these were on insulin, and in terms of the progression of the disease, they were all quite relatively new. Interestingly, they actually conducted the study through GP surgery, so in a primary care setting. And this was to replicate a real world approach, as opposed to typical studies that are conducted in the lab or a bit more artificial. And really simplistically, what they did was split the group into two groups of 149 people, with group 1 following a particular dietary intervention and group 2 given no diet to follow whatsoever. And then the idea is that they would check in with these groups at different time points, particularly after each year. So just to look at that on the board, hopefully you can see it. Group 1 that was given the intervention, they were asked to follow an 800 calorie per day diet for 3 to 5 months. Whereas group 2 was asked to do absolutely nothing, just carry on as they are or approach it however they want to approach it. After 1 year, the researchers pulled their results at that time together, and they found that out of the 149 people in the 800 calorie a day diet, 68 of them achieved remission. That works out at roughly 46% of the intervention group. Now again, the interesting thing was, the more weight that people lost on the diet, the more likely remission was. In fact, 86% of people who had a 15 or more kilogram weight loss pushed their type 2 diabetes into remission, meaning they had no medications to achieve normal blood glucose levels. Whereas only 7% of those people achieve remission if they lost 5 kilograms or less. Now for those people that lost less weight but still achieve remission, chances are they were more newly diagnosed or they had less weight to lose in the first place, because let's face facts, not everyone has 15 kilograms to lose. Meanwhile, in the other group, we can see that despite they had no official intervention, they still managed to have 6 people achieve remission in this group. It's also no coincidence that these 6 people were also the ones that achieved significant weight loss of the no intervention group. So already we can see it's quite clear the effect of remission is weight loss specific. Now a common theme that comes to me quite frequently in clinics, and actually when I'm doing type 2 diabetes education, is talking about 800 calories almost like it's the magic bullet to remission. But I think there's a few more considerations we need to think about, because 800 calories isn't necessarily the magic number. It is the method that people use, or they used in this particular study, to achieve the weight loss they wanted to induce. So their hypothesis was, by losing significant amount of weight, could they put people into type 2 diabetes remission? And therefore they chose an intervention that would almost guarantee weight loss. So remember, there's always more than one way to skin a cat, and if you can achieve that weight loss via other methods, as shown by the intervention group where 6 people also achieve remission, by all means, do it that way. But let's get a little bit under the hood and actually see some other things that's not widely reported about this study and this research. The first thing is, the intervention group, the 800 calorie a day diet group, had intensive dietetic, so nutritional, and nurse support throughout the study. Now this isn't necessarily something you're going to get via the NHS in the real world, so although the study was applied in GP practices to be as closely replicated in the real world as possible, this wouldn't happen through the NHS just due to resources. So actually that support element from a professional standpoint wouldn't be there. Number 2 is, there has been similar research dating back all the way back to the 1980s, so this isn't actually new research. So why a sudden interest? Well, I think the obvious reason is that type 2 diabetes now takes up a tremendous portion of the NHS budget. It's estimated diabetes takes up around 10% of the annual NHS budget yearly. Therefore, it only follows that people are going to start to focus in on ways that we can reduce that cost. And if you can do it through dietary interventions, all the better, because in theory that doesn't really cost the NHS anything compared to medications that does. One of the reasons we've probably not actually heard about this research as we have with the latest evidence is because the numbers were small in these studies, and remission wasn't really a term coined until very recently. So although there was promising research coming out, it wasn't just widely publicized. Another reason is that actually a lot of the outcomes with regards to weight loss and type 2 diabetes remission was that they were actually not looking at that primarily in the studies. They were looking at something else, and that just happened to be another interesting finding that they found along the way. So it wasn't really what they were interested in necessarily. Number 3, as I just referenced, it's not 800 calories specific. So there's lots of different ways to achieve this. The researchers were quite open in their approach that they just happened to choose 800 calories a day in order to guarantee weight loss. So if you're thinking about going on a type of diet to try and push your diabetes back into remission, it doesn't have to be 800 calories a day. And we'll talk a little bit more about the specific considerations for that as we get further down the list. Number 4, and let's really hone in on this, as we mentioned it at the beginning, is the length of diagnosis and the treatments that those patients were on. So all the patients that entered the trial were newly diagnosed within 6 years of diagnosis, and none of them had progressed onto insulin. Now, when you go onto insulin, it shows that there has been almost a tipping point in the disease where your body's no longer just insulin resistant. And if you want to look up insulin resistance, Google it, or I've done a lot of blogs about that sort of stuff on diabetesdietguide.com, or even check out some of my other videos about type 2 diabetes. I talk about it all the time. But when you progress onto insulin, not only are you insulin resistant, you're also likely producing less insulin. So the pancreas is starting to wear out. And the higher doses of insulin you require, you're becoming more and more insulin resistant, and you're producing less and less insulin, more than likely. So now if you're someone that your pancreas is starting to wear out and you're producing less insulin, the physiology of what's happening in your body is shifted from insulin resistance, where you can undo that by getting fit and healthy and losing weight because you're shedding fat from around the liver and from the cells in the body, to a point where weight loss isn't going to help so much in terms of your insulin producing capabilities. So when people start getting on higher doses of insulin, you're probably not going to achieve remission. But it doesn't mean that all hope is lost. At any point with type 2 diabetes, lifestyle change and weight loss will always improve the condition. So it's never too late, but remission primarily is for people that are on low doses of insulin or not on insulin at all, and ideally you'll be diet controlled. So essentially, the less medications you take and the lower your blood sugars are based on what medications you're taking. So let's say you just take metformin and you have good glucose control based on that, you'll have a better chance of pushing your diabetes into remission compared to someone who's on 3 tablets, high doses of insulin, because we can see the disease has progressed just by the nature of their treatment. Number 5, and another important consideration, is actually looking at the pros of the approach. Now, as a dietitian, I'm never particularly enthusiastic about recommending 800 calories a day. You know, it wasn't long ago that we thought of this as almost an anti-diet. But actually, when you start seeing a lot of patients coming through the door, often some that are fairly elderly, or they have other medical conditions which render them quite immobile, so they can't burn up energy like they used to, suddenly maybe there is a place for this kind of diet. Maybe not necessarily 800 calories all the time, but maybe a happy halfway house, or even just 800 calories to kickstart something to help improve their health in the first instance. Now, what I like about this is if you just give someone a certain amount of calories and they actually achieve this through shakes in this version of the diet, but actually you can do it through food as well. But it's very simple. Here's your diet plan, or here's your shakes, crack on, we'll touch base in a week's time. Like I say, not my preferred option, but it is very simple. People can tune into it. And also, as I said, for some people, it can be useful because they might not be able to actually get active. So that way we have to cut back their calories. And it's hard for people to intuitively cut back calories. You know, they think because they've made a certain amount of changes in their diet, that automatically leads to weight loss. But we know that's just not the case. So sometimes we actually need to take some extreme measures and kickstart something so they start to see results, and that spurs them on. And I guess the other point to really think about is actually time and time again, lower calorie diets are proven to be much more effective for weight loss compared to other approaches like the Mediterranean diet or intuitive eating. And it makes sense because you're really cutting back your calories. It's a low calorie diet. So you're actually mobilizing that fat that you store in your body and using it because it needs that to actually fuel your body. Now, that leads us on to number 6, which is the cons. Now, obviously, with going on to an 800 calorie a day diet, you're not going to stay on that for the rest of your life, so you need to come off it at some point. And obviously that's a problem because then we start to think about, well, what are you going to go back onto? And that ties in with the long-term sustainability. It's no good if you go from 800 calories back to the status quo, because you'll start to put the weight back on. And that's, as I said, what we see with the 1980 studies. After 5 years, most people are back to where they started in the first place, which isn't a great thing particularly. And I guess we'll have to wait some time to see if that actually has an effect on long-term health outcomes, because we just don't know. Is it good to even get that initial remission and then come back later with the diabetes back to where you would have been anyway? Does that have benefit? Or is it have no additional benefit if you just left it and got to that point anyway, but had higher glucose levels in between, if that makes sense? So yeah, maintenance is a big thing. Also, like I say, it's not my preferred option. It is a bit extreme. It's not really teaching anyone about their lifestyle habits or how to eat or how to manage their lifestyle longer term. So you're not really building those initial skills and getting the tools in the toolbox in order to be able to live a healthy and full life that ideally you'd be building from the start, because really you just want to continue as you mean to go on, rather than using crash diets and then rebounding later. Although some people do find that having strategies in place like 800 calories a day for a short period of time just to reset them can work for them. So they kind of fluctuate a little bit, but the idea is as they start to see their weight creeping back up, they'll use their strategy to get back on the regime. They'll drop back to where they want, below where they want to be, and then they'll creep back up. Not my preferred way of living, but some people do that. So, you know, if that works for you, power to you. And one of the final points I just wanted to discuss is, now obviously this was published at the back end of 2017, early 2018. So there's been an extra year in between that. So we actually have year 2 data to see what happened with these patients a year on after the initial checkpoint that we just reported on the other page. And we can see that after 2 years, 36% of people, down from 46%, managed to remain in remission. So less people are in remission after 2 years. So we'll be interested to see where we get to now on year 3, 4, and 5 and beyond. So we're having to query the long-term effectiveness. And like I say, we don't know if there is benefit, even if you achieve remission for just a year. Does that have beneficial effects longer term for your diabetes? Probably would be my guess, but I'm led by the research and I don't just make my own opinions up and give it to patients. You know, we see what works and then we apply that in practice. Obviously we draw on experience along the way, but we don't really have a great deal of long-term research looking at this. So I won't just use my opinions and guess. We'll look at what the evidence says. So, but it is a query about that long-term sustainability. And actually, like I say, if people can't stay on the diet or they rebound off it and it has a negative impact and they put the weight on and some, then actually what are we trying to achieve in the first place by going on an 800 calorie a day diet? Wouldn't it be better to actually just get on, say, a more sustainable 12 to 1500 calorie a day diet, which is still quite low, but actually for a lot of these patients it's what they need because they don't move very much, probably less than 1,000 steps a day, no formal activity. They really struggle to shift energy or expend energy in order to initiate weight loss, unlike someone like myself who, you know, fairly still quite young at the moment, so I can actually just get out, go for a run, burn it off when I know I've been a bit naughty on the diet. If you take that luxury away, I think I'd also struggle. So for anyone that is watching that doesn't appreciate that, maybe just tune into it because it is very difficult for some people. And that's it, guys. So I hope you found this useful. It's a very quick run through about the research, the background, and some of the considerations that we need to think about when we're analyzing such diets. Now, if you're considering going on this diet, and this is a crucial point to stress, if you're taking certain medications for your diabetes, always tap in or tie in with your GP, your diabetes specialist nurse, or your diabetes team, because going on such a diet like this, very low calorie, can have implications for your medications, and they may need to be changed about, particularly if you have anything that pushes your blood sugars too low, like insulin or sulfonylureas, or anything that is reliant upon a certain amount of food intake or hydration, such as an SGLT2 inhibitor. They end in the gliflozins. So just keep that in mind. Always speak to your GP before changing your lifestyle, particularly if it's going to be quite an extreme measure like a low calorie diet. Now, if you did find this useful, remember to subscribe and like the video if you did like it, dislike it if you didn't like it, and hit the notifications if you want to see when I publish more videos. I'll leave it there, guys, and I'll see you at the next video.